and whooping cough are not the same. The similarity that they have is that both of them are usually preventable by administration of the DPT vaccine. But now, when it comes to comparisons, the causative agent is usually different. Whooping cough is caused by the P. pertussis. The diphtheria, we've talked about the C. diphtheriae. Uh, the mode of transmission is the same for both of them, droplet infection from coughing and sneezing. But again, now, for whooping cough, the major site that's affected is usually the trachea and the bronchi. For diphtheria, usually affects the throat, the tonsils, and the upper respiratory tract. So they are not the same, but the only similarity they have is that preventably they can be prevented by the same vaccine, the DPT vaccine. But the clinical manifestations, uh, um, causative agents are all the same. I mean, are all different. Otitis media, inflammation that affects the middle ears, usually causes blockage of the Eustachian tube, which now leads to swelling of the mucous membrane of the tube. Can be caused by S. pneumoniae, H. influenzae, S. pyogenes. So otitis media usually affects the ear. Symptomatically, there will be ear pain. There will be orthorea, that is now discharge uh, from the ears, damage to the eardrum as one of those symptoms. Usually can be managed by painkillers and also encouraging the patient to rest.